Hey guys, this is Dr. Drew Kidwell with Piedmont Concierge Physical Therapy.
I'm Amanda Fournier. I coach at Bull City CrossFit.
And we're here today to talk about a common fault that we'll see with our CrossFit athletes stepping up onto a box and also the squat as well. So Amanda's going to demonstrate stepping onto the box in this knee valgus or knee collapsing movement that we'll see sometimes with athletes. So if you look at Amanda's knee, her knee is caving in as she's stepping up onto the box. How would you cue an athlete if you saw that in a class? What would you tell them?
I would ask them to keep their knee over their toes as they're stepping up.
Right. So let's say your athlete is collapsing in like that, and you cue them, drive your knee out over your toes, and you still don't see that corrected, and it's still collapsing, you're still observing knee valgus. What you can do is you can take a band and you're going to place it around the knee like so, and then Amanda's going to have her foot up there on the box. And now what this is going to do is going to cue, you're going to ask your athlete to drive their knee against the band out over their toes as they go into that step up there. This technique is called reactive neuromuscular technique, all right? So it's essentially, we're cueing the athlete with a band to drive the knee out this way as opposed to it just collapsing in without the band. Another thing that we wanted to talk about was a common, this same thing, the knee collapsing, knee valgus with the squat. So if you look at Amanda, her knees are caving in slightly as she goes into her squat. And then again, as a coach, you're gonna hear the cue, drive your knees out, right? So pretend like there's a band around your knees and you're driving those knees out, trying to break that band. Now, if the person still doesn't respond to that verbal cue, what you can do is you'll take a band, place it around your knees. Same concept as single leg, but now we're just doing it bilaterally with the squat. And then you're trying to really drive those knees laterally against that band, trying to rip that band apart. Anything you wanted to add to that?
The reason that we like the knee to stay over the toes is to get more glute and hamstring involvement rather than through their hip and their quad.
So if you're dealing with medial knee pain, so maybe you're experiencing front-sided knee pain or inside of your knee with box jumps, step-ups, squats, try these two techniques and see if that helps improve your pain. But let us know if you have any questions.